All right, so in the other discussion, we ended on the lymphocytes. I was explaining about the CD4 cells. Now, just to continue from that, we'll look at another type of lymphocyte. Remember, lymphocytes are two types, B and T lymphocytes. Okay, now, the next type of cell we'll look at is known as a plasma cell. Now, a plasma cell is a B lymphocyte. I want us to understand each other perfectly well here. A plasma cell is a B lymphocyte. The difference is when a plasma cell, when a B lymphocyte is activated by presence of infection, a lymphocyte undergoes some change. That is a B lymphocyte. It hypertrophies, it increases in size to become a plasma cell. So plasma cell is simply an activated B lymphocyte. What do we mean by activated? This is a B lymphocyte that is actively producing antibodies, or what you call immunoglobulins, targeted against a specific antigen that caused this B lymphocyte to be activated to become now a plasma cell. So we have various types of antibodies, shortly abbreviated as GAMED. GAMED meaning GAMED. So those are the common antibodies that we have. Antibody G, antibody A, antibody M, antibody E, and antibody D. I'll not go into details of how they appear and how they fight off infection in the body. For now, we'll just end at knowing, say, there are 5 antibodies. Okay, so that's all about the plasma cell. It is simply an activated B lymphocyte. Okay, so this diagram here is showing us all the cells of connective tissue, both the permanent cells and the transient cells. I'm sure you remember which ones are permanent, which ones are transient cells. Okay. All right, so within the transient cells, we also have these other cells like eosinophils, neutrophils, basophils. If you look at them, these cells have a similar suffix, phal, phal, phal. Now, neutral means no charge. Eosinophil means acidic. Eosino is acidic. Baso means basophil, which is alkali in nature. So when you are staining cells so that you can identify them under a microscope, you stain them or you dye them. Neutrophils do not pick up any stain. Eosinophils pick up stain, which is acidic, so they appear pinkish in color. Basophils pick up alkali stain, and they stain bluish or purple. So collectively, these cells from number 1, from 3, 4, 5, we call these as granulocytes. So these are granulocytes. Okay, and of these, we see them in different type of infections. For example, a neutrophil will enter connective tissue as the first immune cell to arrive whenever there is infection, injury, or anything that is disturbing the tissue. Whereas eosinophils are seen in parasitic infection. When the body or connective tissue is attacked with parasitic infection, eosinophils will migrate from blood and enter connective tissue. Then basophils are seen when there is worm infestation, and also seen in allergic or what we call hypersensitivity reaction. So a basophil together with mast cell are highly active when we have worm infection or allergic reaction. So people have asthma. It's because of overactivity of basophils and mast cells. Now, these cells, we're saying they are granulocytes because they have granules in their cytoplasm. They have granules in their cytoplasm. And those granules are secreted only when there is those infections I've mentioned earlier on. So this is eosinophil, this is neutrophil, this is mast cell. Now, in terms of appearance, a mast cell and a basophil appear more or less the same. So it's very difficult to distinguish which one is a mast cell, which one is a basophil, because the two cells appear similar. But this is a neutrophil. We can't miss it because neutrophil has 3 lobes. The nucleus appear to be 3 in segments, 1, 2, 3. Now, one thing you should take note is that a neutrophil is used to determine the gender of an individual as well. So a neutrophil whose nucleus has this extension you are seeing here, that appears like a drumstick of a chicken leg. Here, we call it a drumstick. We call this as bar body. This is a bar body. This is a bar body, more like a drumstick. This is seen in female subjects. So we can safely say this blood with these cells was taken from a female subject. We don't see this in a male subject. So the neutrophils in males do not have this extension here, which is making this appear like a drumstick. I'm repeating this for the last time. A neutrophil is used to identify the gender of an individual. So when you take blood sample from a person and then you do what you say a blood smear and study that blood, when you identify a neutrophil and see that it has this extension looking like a drumstick, then definitely this is a female. Without even looking at the file of the patient, you should conclude that that is a female individual. Because in females have 2 sex chromosomes. Equally, males have 2 sex chromosomes, but in males we have X and Y. In females we have X and X. So in females, 1 X chromosome is inactivated, and that is called bar body, and this is what you are seeing here. So in females, for you to see features of a female, large breasts that are well developed, small shoulder diameter, wide pelvis, all those are determined by the X chromosome. So only 1 X chromosome is enough. The other one is inactivated. Okay. Then the last cell to look at under transient cell is a cell known as monocyte. Now, a monocyte, this one here, we need to be together here. A monocyte is a macrophage of blood. So, in terms of size, monocytes are a bit smaller from macrophages, and they are always found in blood. Now, when a monocyte migrates from blood to go into connective tissue, the monocyte changes from being a monocyte to becoming a macrophage. So it increases in size and therefore remain trapped in connective tissue and cannot go back to blood vessels. And that's what we now call them as macrophages. So we can use monocytes and neutrophils to determine how long infection has been there in connective tissue. So if you open connective tissue and this connective tissue is suspected to be infected, then you find the neutrophils present. Just know that that is fresh infection. It's acute. It has just occurred in a few period of time, maybe days or maybe a week or so. But when you find monocytes in a wound in connective tissue, then know that there is chronic infection, because neutrophils are the first cells to arrive in any site of body where there is infection or injury, whereas monocytes are the latecomers. They arrive late when these other cells have done their functions. And the main function of monocyte is simply phagocytosis. Destroy anything that is foreign or any dead cells that belong to the body. Neutrophils, eosinophils, basophils can also do phagocytosis to some extent, but their main function is to produce those chemicals found in their cytoplasm, and those chemicals are the ones that are used to destroy the invading cells, bacteria, fungus, or virus. So that's about cells of connective tissue. We have permanent cells here, fibroblasts, fibrocytes, myofibroblast, macrophages, adipocyte, mast cell, and stem cells, or what we call mesenchymal cells. Then wandering or transient cells or temporary cells, we have lymphocytes, under which we have T and B lymphocyte. Then when a B lymphocyte is activated, it's known as plasma cell. Then we have these we call granulocytes, neutrophils, eosinophils, basophils. And then finally we have a monocyte. Since we are done with cells, let's look at fibers now. So we are done with this part of connective tissue. The other component of connective tissue is fibers, which are listed here: elastic fiber, collagen fiber, reticular fiber. When we're done with this, we finally look at ground substance. So let's quickly digest the fibers. So there are 3 fibers, okay, beginning with collagen. So we'll start with collagen. So collagen is shown here. So collagen is the largest and strongest fiber of connective tissue. It's also the most abundant protein fiber of connective tissue. We're seeing it here. That's collagen, collagen, collagen. Then these are blood vessels. This is artery. That's another artery. Collagen. Okay. Now, collagen appear in so many types. Okay. We have what we call fibrillar collagen, sheet-forming collagen, and linking or anchoring collagen. Okay, so fibrillar collagen forms fibers, like we have seen in the previous slide here. These are fibers. Then we have also what we call sheet-forming collagen. This is collagen that forms, for example, tendons. It's part of the tendons and ligaments. Then anchoring is more like fibrillar, but its main function is to attach adjacent structures. Okay. So here we have different types of collagen, type 1 up to type 7, but really this is not useful. It's just for your own information. If you want to study, you can get some time, especially through the weekend, you can sit down and look at the types of collagen that are there. But what is important is knowing that collagen is of 3 types, like that. 3 categories or groups, if you like. Then types is 1 up to 7. Okay. Now, collagen synthesis is dependent on high supply of vitamin C. So without vitamin C, the quality and quantity of collagen produced is poor. And these are individuals that we see having bleeding disorders in the mouth, what we call scurvy disease. So scurvy disease is because of individuals not taking fruits. And fruits give us high quantity of vitamin C. So the only treatment to scurvy disease is allow this person to ingest as many fruits as possible. Okay. Especially oranges, which have a high content of vitamin C. Then sooner or later, you see that that bleeding tendency disappears. What about other fibers? We have reticular fibers. Now, reticular fibers, I already explained that reticular fibers form like a mesh. If you can assume a mosquito net has holes or spaces and the cotton meshwork. That's how reticular fiber appear. And what we are seeing here are cells. This was a liver. So these are nucleus of hepatocytes. So it forms a framework or the skeleton upon which cells will sit and then form organs. So all soft organs in the body, liver, spleen, pancreas, kidney, their skeleton is reticular fibers. Okay, so here a special stain was used. This is silver staining to demonstrate reticular fibers. Which cells are producing these fibers? It's still fibroblasts. The last but not the least is elastic fiber. Now, difference between elastic fibers and reticular fiber is this. Reticular fibers form a meshwork, but elastic fiber forms branches. If you follow these small strands, these are reticular fiber. The larger ones we are seeing in the background there is collagen. That is collagen, the largest. Then that's elastic fiber. So elastic fiber allows this connective tissue to stretch and recoil like the skin. You can put the skin on it to assess the rigidity of the skin, and then the skin will go back to its original position. That's because of high presence of elastic fibers in them. We also find elastic fibers in medium and large size arteries and veins. For example, vena cava, superior and inferior. For example, aorta, ascending aorta, arc of the aorta, descending aorta. Those vessels carry blood at high pressure. So to prevent them from bursting, these vessels need to expand when the heart is contracting and relax when the heart is also in diastolic phase. So that's where we can find these elastic fibers. Which cells are producing these fibers? Again, it is fibroblasts. Okay, another diagram here showing us elastic fiber. So we are done with the 3 fibers produced by collagen. We are now looking at ground substance. What is the main function of ground substance? So ground substance is like a lubricant. At the same time, act as a barrier to microorganisms because it is not in liquid form. It is more like a semi-solid structure, a semi-liquid structure, like a jelly. That way, it takes time for microorganisms to swim through it. And like the way they find it easy to swim through the digestive juices, intestinal juices, gastric juices. When they come in contact with ground substance, microorganisms do not move as fast as they're supposed to. And therefore, they will be arrested so that those cells from blood can find them and destroy them. Therefore, ground substance is semi-solid or semi-liquid. It is amorphous. It has no shape. It is a liquid anyway. So it can assume any shape in which you can put it. Okay. So what makes up ground substance? Ground substance is made by proteoglycans, number 1. Then glycosaminoglycans, number 2, or simply abbreviated as GAGs. Then lastly, it is formed by glycoprotein. So I've mentioned 3 substances that makes up ground substance: proteoglycans, glycosaminoglycans, and glycoproteins. Glycoprotein, glycosaminoglycans, and proteoglycans. When these chemicals are produced by fibroblasts, they mix up and form ground substance. So ground substance is colorless. It's like a fluid, a jelly. Okay. And it has those properties, enabling metabolic processes to occur in connective tissue. So it's simply an aqueous environment. And we know that all chemical reactions in the body must take place in an aqueous environment. These saying other types of gags, so this is not really important at our stage. This is master's level. Okay, when we wish to do anatomy or physiology, we may learn more about types of gags that are there. But for now, what I want you to know is proteoglycans, glycosaminoglycans, and glycoproteins is what forms ground substance. What is the function of ground substance? Acts as a lubricant to the fibers that we've mentioned, that is collagen, elastic, and reticular fibers. At the same time, acts as a medium of metabolic reactions so that cells are getting what is useful from blood and giving back waste material through it. So diffusion is occurring across ground substance to the cells and back to the blood vessels. Last but not the least, also helps in preventing the spread of microorganisms in connective tissue. Okay, so in the next session, we'll now look at types of connective tissue. We say we have connective tissue proper, which is loose and dense connective tissue. Then we have specialized connective tissue, which is formed of adipose tissue, elastic tissue, mucoid or myeloid connective tissue, mucous connective tissue, then finally you have bone and cartilage. So this is where we end for today. All right, so for any questions, you can still get in contact with me. I'll be able to explain more about these tissues that we've discussed so far.